Welcome, everybody. It's Katie with Ria Health, and I'm here today with Dr. Paul Linde. Dr. Linde is a San Francisco-based psychiatrist with 30 years of experience in the field, including treating substance use disorder using harm reduction-based care. And he's also a team member here at Ria. And so I just want to say welcome and thank you so much for taking time to speak with me today.
Thank you, Katie. I'm glad to be here.
Wonderful. Well, my question for you is around the topic of how to stop drinking alcohol. I think a lot of people that struggle with alcohol use disorder, um, you know, really ask themselves this question a lot, given that there is so much, so many challenges in the recovery space for people to have long-term recovery. And so, how is it that someone can begin to stop drinking alcohol?
So I would say the first step, and maybe this seems obvious, is that sort of take a closer look at whatever consequences you've had from drinking alcohol, because therein, for most of us, lies the motivation to cut down and perhaps eventually stop drinking completely. And to find your motivation is going to be key because, as they say, really, it's up to you to change your behavior and change your way of thinking about alcohol if you're going to be successful in cutting down or stopping alcohol. So, the experts actually call it readiness for change, and there's a whole kind of scale rating system. If you can look it up if you'd like to, but I'll leave that to you to do on your own. But usually the consequences from drinking, as probably many of you are familiar with, kind of fall into two camps. There are the physical consequences of drinking and the social, family, work consequences of drinking. The physical consequences are pretty numerous. One is it's hard on your brain, and some people feel a little bit foggier the longer they drink. Also, it's very hard on your gastrointestinal system. A lot of folks develop gastrointestinal bleeding, either from your esophagus or your stomach. Other folks develop damage of their liver with an increase in your liver enzymes, which you can see, your doctor can see on your labs. It affects your pancreas. Some people with alcohol issues have pancreatitis. And it can ultimately also affect your neurological system. And clearly, it affects mood as well, which we'll get into. The other sort of consequences, and these often are more compelling for people because relationships, if you're delivered an ultimatum by your partner, for example, um, and then work as well. If people have consequences from the workplace, absenteeism, coming in late, getting busted on the job for drinking, um, hangovers, all that stuff. And hangover is alcohol withdrawal, basically. And then legal issues, clearly. So a lot of people come into this with trying to avoid negative consequences. I think we'd all like to think we're responding to seeking positive things. And I think ultimately you'll get there. But most people don't start there. Most people start with, oh, my life is a mess. I don't want to blow my family relationships. I don't want to blow my career. I don't want to go to jail, etc.
Yeah. So, say someone has tried to quit drinking a number of times through traditional approaches that are commonly known, like AA or checking themselves into rehab, and they keep failing. What other options are there? Or, I hate to say that they are failing, but perhaps the treatment is failing them.
Yeah.
What other options are there for those people?
So AA, Alcoholics Anonymous, is a tremendous option for some people. It has saved many people's lives. So I am actually supportive of AA. Having said that, it's not everyone's cup of tea, so to speak, that some people don't like the spiritual, the God part of AA. Other people feel like they're triggered to drink when they're with a bunch of other folks with alcohol and substance use disorders. There's a lot of reasons to, not like AA. So for those folks, there are alternatives to AA called Smart Recovery, in which you use both cognitive behavioral. So you change your behavior on ways other than using the 12 steps of AA. So it's called Smart Recovery usually. That's one option. Um, However, from my experience and my perspective, I do think starting with a harm reduction approach can be a good way to go. And harm reduction just means cutting down before you stop completely. Some people decide that that's their goal, they just want to cut down. Other people decide they want to stop, but they understand that sort of going slowly may be better for them than going cold turkey. And in fact, when I've treated patients in the clinic that I work in, I advise people to cut down first, thinking that's an easier goal for people than stopping on a dime. Um, and I've had patients drink as many as 15 drinks a day, which we have patients at Ria, many will drink 10 to 15 drinks a day. Certainly not everyone, but we are able to manage patients with that heavy of a drinking style. If you stop cold turkey drinking 15 drinks a day, you're going to have pretty serious alcohol withdrawal. And that's what a lot of detoxes are meant for. But that's an uncertain process, and it's difficult to access, and it's pretty unpleasant. And the reality is you're then detoxed, and then you can go to an abstinence model. So that's the old way of doing it, is going to a detox of 3-4 days, and then going to a residential inpatient rehab program. That's the typical 30 days. And then going to some aftercare, intensive outpatient or other aftercare. And that is always AA model. Almost every recovery program, residential rehab, is on an AA model. And again, I'm not knocking it. It's worked for a lot of people, but I'm really speaking to people for whom that hasn't worked. So what's your alternative? So the alternative is, when you decide to cut down, there are ways we can help you cut down. And we ask people, hey, do you want to cut down or stop? And I personally, I'm not going to lie, I prefer the answer of, I'd like to stop, but I know it's going to take a while, and I want to work with you to figure that out. I prefer that to just cutting down. I think it's a little dicier, but I do think it's very helpful. So if that guy who drinks 15 drinks a day, if I can get him to 4 or 5 a day, medically, psychologically, his life's going to be a lot better. And because 15 drinks a day is probably going to kill you in a few years if you keep it up. Anyway, so one can take medication to cut down. And in fact, probably the most common one that we prescribe is called naltrexone. And naltrexone is FDA approved for cutting down or stopping drinking. And what it does is it's basically a blocker of opioids. So things like heroin, obviously, but also narcotic pain pills, is it blocks that and reverses it. So you have to be really careful taking both of them simultaneously. But the way naltrexone works is, basically when you're on naltrexone, there's less reward involved. So why do people drink? Going back to motivation, you sort of, what's the upside? What's the downside? Well, the upside is, let's face it, alcohol feels good when you first start drinking for most people. And that's why people continue to drink. Less anxiety, feel less self-conscious, can loosen up, just it feels good. And the people who can do it in moderation, which maybe 2 to 3 at a sitting, they just do that. Maybe 4 or 5 once in a while. But for other folks who are probably genetically programmed to drink more, if 3 or 4 is good, well, 7 or 8 is good, and my God, 12 or 13 is even better. So, but naltrexone then makes it less rewarding to drink. So what I've heard my patients say, they come back and they go, hey, I drink, but I don't enjoy it as much, and so I don't drink as much. So typical would be someone who's drinking 6 to 8 drinks a day, and they can relatively easy cut down to 2 or 3. Usually it takes a while, but they can usually do that. And that's a great place to start. That's the way I think of it. There are other medications that help people either cut down or stay sober. Another FDA approved medicine is called acamprosate. The generic is called Campral. And it has a track record of helping people stay sober. So I would say naltrexone gets you drinking less, and can keep you sober in the long run. But acamprosate really works when people have been sober for a period of time. It really helps, not everyone, but it helps a lot of people not drink. Other medications FDA approved for alcohol use disorder, disulfiram or antabuse, which is sort of the old from the 50s, I believe. And our program doesn't prescribe antabuse, and I did rarely in my practice. So the reason is that it's pretty aversive and it can be kind of dangerous. So basically, if you drink on it, you get really, really sick. It doesn't kill you, but you probably wish you were dead, and you have to go to the ER if it's bad. So I generally don't go to disulfiram or antabuse. There are other medications that are not FDA approved, but have been shown in research to really be helpful in helping people cut down or stop. And one is gabapentin, which we'll talk about when we talk about anxiety. That was originally for seizures, but we see that it works well for alcohol withdrawal, anxiety, insomnia. The other ones that are prescribed commonly are baclofen, Baclofen, which is a muscle relaxant, and another one is called topiramate or Topamax. That's spelled Topiramate. Also a seizure medicine. Does seem to help people also cut down on their drinking. So medication can help a lot on the front end. I've seen it do wonders for a lot of patients. It's not for everyone. Some people have side effects and have to stop. Other people, don't stay with it, but it's helped a lot of people. It's made it easier for people to cut down and hopefully eventually stop.
And just question about that, when you say it's helped them a lot on the front end, like what is then the second step to that? Say someone gets going on medication and they're responding, then
Mhm.
what? What else needs to happen?
Well, I mean, I think the real work comes in getting someone to help you, whether it's a therapist or a substance use coach. And in fact, there's research has been done that coaching as a modality probably works better than quote one-to-one therapy. And not that there's anything wrong with it. It can be super helpful to have a therapist because you may look at some of the roots of your drinking. But in terms of coaching are usually certified drug and alcohol counselors, some of whom have been in recovery themselves, and they give you the practical stuff to cut down. So looking at your motivations, so things like helping you find alternative activities to drinking. A
Mhm.
lot of people drinking is really specific to an activity or going to the bar or hanging out with this group of friends. And part of what you need to reevaluate is, are there things you can be doing with your time that are better for you? Are there folks who aren't just focused on drinking, maybe you should be hanging out with instead? Are there activities that if it's going to the football game, I always get wasted before the football game. Well, I mean, maybe next time you go and have 3 or 4 with your buddies and you don't get wasted, but you still had a good time and drank with your buddies. That's legit. But, things, making changes like that. So finding alternatives. I think the other thing people definitely need to do is look at your support network. Who are the people who can support you in this effort? A lot of times it's a partner, could be your kids, could be your siblings, could be your parents, could be your friends. And what you might find is the people who are most supportive among friends are those who either don't drink at all or who are social drinkers. Because the people who are your friends and the context of your friendship is about, drinking a lot. Um, those folks sometimes aren't very comfortable with you if you say I'm cutting down or quitting, and you can get a lot of pressure from long-term friends who you really like to not do it. And again, it's an adjustment you have to make. You have to look at every aspect of your life. You have to look at your social life. Another thing that's very helpful in cutting down on drinking is making some healthy practices, things that give back to you that don't involve drinking. Lots of examples of those. Exercise is great. If it's aerobic and running, cycling, that's great. If it's weightlifting, excellent. If it's things more like yoga and Pilates that give you a great workout, but also really refresh your mind. So having healthy activities, including exercise, is one. A second one is a lot of people utilize meditation to calm their mind, not needing to go to alcohol. And so Meditation can help you do that. It's a difficult practice to start and continue. It takes discipline. I'm speaking from my own experience as well, but it can be really helpful. Another term for that is mindfulness. You may hear that term. Um, Picking other activities to do that don't involve drinking, whether that's maybe doing something with your kids more, with your partner more, that's non-alcohol related. So really finding a support network and a community that is on board with your goal. What you're likely to find is that there's a lot of other people who've gone down the same road who can be real support to you. And then you don't feel so isolated. So part of that is not isolating yourself, not feeling alone. I mean, think about how many times that you and your best friend Al Cohol have sat down to have a pity party and, drink by yourself. I think anyone who's had any alcohol problems has had that scenario. For some people, it's also useful to track your drinking, to get a handle on it. So to try to identify what your triggers are to drink, what's your motivation to drink. On the days you decide to not drink, how did you make that decision? And sort of monitoring also the amount you drink, how long you drink, and what's the context of your drinking. And that's what a coach can really help you with, identify what are the patterns that are keeping you drinking. And so it's a matter of creating different patterns in your life. So it's great to keep track of it. Some people even get a breathalyzer. You can get your own breathalyzer. They're pretty inexpensive. I think around $50. You can get your own breathalyzer and track it. And in the program Ria, that's a cornerstone of what we do with treatment at Ria. And Ria actually sort of is on a three-legged stool. Medication assisted therapy. So medication is one part of it. You'll see a physician or a nurse practitioner on the front end to talk about medication. The second leg of the stool is the coaching. And the coaching staff is excellent. Just people with experience and compassionate and caring, and they really know what they're doing, and they actually really do care. They want people to get better and feel comfortable when they're talking. And then the third leg of the stool is what I call sort of the digital platform, the digital aspect of it. And that includes data. The data we have in reducing alcohol use is based upon numbers, and the number we have best access to are breathalyzers. So you, in real time, you give a breathalyzer, and via the digital interface, literally via Bluetooth, you download an app. The app's on your phone. You set up Bluetooth with your breathalyzer. You blow into the breathalyzer, and literally the data gets entered, and something that your coaches and your medical team can review in real time. And it's not meant as a way of checking up on you and getting you in trouble. It's really a way of keeping you accountable and giving some real data. And so you can better understand the patterns that you fall into when you're drinking.